to today's webinar, Tricare Choices for National Guard and Reserve Members. We are thrilled to have Brian Smith with us today, who is Program Manager of the Reserve Component Health Plans, Policy and Benefits with Defense Health Agency. Without further delay, I will turn things over to Brian Smith.
Thank you, Stan. First and foremost, before we get started, I'd like to extend my deepest appreciation to all the men and women in the Reserve Components for their service, as well as to their family members who support them. And I'd also like to extend this same appreciation to those who assist these members and their families in any capacity. So really, again, appreciate all that you all do out there, especially during difficult times with transitioning and what have you. So thank you for all of that. What I need to do here is read the disclaimer, and then we'll go ahead and proceed into the presentation and webinar. So the appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. Next slide, please. So today we'll be discussing the various life cycles or status changes of a Reserve Component member and how they impact their eligibility with various Tricare health plans for them and their families, as well as other benefits associated with the Reserve Component and information with getting assistance. Just a note here, I'm going to be acronym or shortening the Reserve Component with RC for those in the webinar. Next slide, please. So the Affordable Care Act, this legislation was signed into law January of 2016 and requires all Americans to maintain basic health care coverage, also referred to as minimal essential coverage, which, by the way, the Tricare program does meet. You can look into your state's healthcare marketplace exchange and see if they have, if what they have to offer meets your healthcare or financial needs. Because we here at the Tricare and the Defense Health Agency suggest that when you're choosing your healthcare coverage for you and your family, we encourage you to research all your options so you can make a very sound decision. While it may or may not be the best option for you, Tricare, know that there are other options for you and your family. Next slide, please. So to be eligible for and obtain Tricare coverage, everyone must be registered in DEERS. Service members are loaded in DEERS by their personnel office, and they do that for them. And it is the responsibility of the sponsor or service member to register their family members. And you can do this through several means, by a couple of means, by actually going into a Uniform Services ID card issuing facility, or by sending the required documentation directly to the Defense Manpower Data Center Support Office. And there is a link there as far as if trying to locate an actual DEERS ID card facility that will, you punch in your zip code and it'll bring up the nearest locations to that zip code. Next slide, please. It is very crucial that you maintain and keep all your contact information for the entire family current in DEERS. Anytime there is a change of such information, you will need to update that information as soon as possible. Tricare information and any changes to its program or your coverage through notifications are sent to your residential address as well as personal email that will direct you ultimately to Milk Connect, where more detailed information and explanation is posted. So as you can see here in this slide, there are a couple of options for how to maintain or update that information by either going directly into Milk Connect or by calling DMDC's support office. as well as faxing that information in as well. Again, there's the link for the ID card issuing facility there, as you can go into that facility to update DEERS as well. If you do need additional information or have questions about DEERS and eligibility, you will see you can go to tricare.mil/DEERS. It is really important to make sure when you are updating or maintaining yours or your family's information in DEERS that anytime there's a change, be it in family composition or an address or you move or what have you, that you get that information updated as soon as possible. Next slide, please. Here are the various stages during a reserve component member's career, in which we refer to as a life cycle, and the Tricare health plans and benefits that may be associated with those. Inactive status refers to if the member is either drilling on IDT or AET orders or on any active duty orders for 30 days or less. That is referred to as an inactive status. Pre-activation, as we'll talk a little bit later, is where a sponsor may receive a delayed effective date orders for active duty, and that is then referred to as early eligibility period, and which during that period the member and the family would receive active duty benefits. And then obviously active means you're in that, the sponsor is in that current active duty period. And then coming off active duty, it's referred to as deactivation, and either transitional assistance management program or continued health care benefit program may be an option, as well as possibly Tricare Reserve Select. And in that inactive status, which I refer to as the particular aspects of that, Tricare Reserve Select, or if retired reservist, Tricare Retired Reserve, as well as possibly line of duty would fall into play during that particular status. And we'll be going into each of these health plans and benefits in each status throughout the webinar. Next slide, please. So qualifying to purchase TRS and TRR coverage, reserve component members must be in the selected reserve to be eligible for and qualify to purchase TRS coverage for themselves and their family. Unfortunately, the individual ready reserve and inactive National Guard members do not qualify to purchase TRS coverage. Also, if a selected reservist or retired reserve member is either eligible for or enrolled in a Federal Employees Health Benefits Program, also known as FEHB, in their own right, they do not qualify to purchase TRS or TRR coverage as well. However, if the spouse is eligible for or enrolled in FEHB, the sponsor and subsequent family members may proceed to purchase TRS coverage if they choose to do so. And as I mentioned, for TRR, we refer to the under the Tricare Retired Reserve population as non-regular retired reservists, including Guard, because once Guardsmen retire, they are actually technically and officially listed in the retired reserves. They are sometimes also referred to as gray area retired reservists, and these are folks that will fall under the age of 60. And again, as I mentioned, you know, they cannot be eligible for enrolled in FEHB as well in order to qualify for TRR coverage. Important to note here that if a retired reservist is under the age of 60 and has begun to draw retirement pay, there was recent legislation a few years ago that those reserve component members prior to retiring who did support any contingency could accumulate that time towards obtaining early retirement pay. That particular legislation does not apply towards medical eligibility with Tricare, meaning specifically that that not until the sponsor would reach age 60 would he or she and their family then be eligible for premium-free TRICARE coverage. So up to age 60, any qualified retired reservist, if they sought TRICARE coverage, TRICARE Retired Reserve would be the only option for them up until age 60. Also important to note that the TRICARE premium-free coverage, which is typically referred to as TRICARE Prime, or what was previously known as Standard, which is now Select, is what then the sponsor and family members of a retired reservist would be eligible for once the sponsor reached age 60. Next slide, please. So for purchasing TRS or TRR coverage, this can be done by going online to the beneficiary web enrollment application and submitting an enrollment request electronically. Unfortunately, currently this option is not available overseas. To do this, you will need a Common Access Card, or what's referred to as a CAC, a DFAST PIN, or a DoD self-service logon account to access this particular beneficiary web enrollment or BWE application. You can also fill out the request and print it and submit it in the mail if you choose to do so. You can now also call your regional contractor and submit a request over the phone. This policy change was implemented January 1, 2018. So when purchasing TRS or TRR coverage for the first time, or you're coming off an active duty period or any other status change in which the sponsor would then qualify to purchase TRS or TRR coverage, you must pay 2 months premium and provide either a recurring credit card number or an account information for an electronic funds transfer at that time. For continuous coverage, you must submit your request for enrollment up to 90 days before or within 90 days after coming off other TRICARE coverage. Next slide, please. And as I just mentioned about continuous coverage, again, it's 90 days prior to or within 90 days after coming off other TRICARE coverage. That used to be 60 days, and with some changes to TRICARE that were effective January 1, 2018, that was extended 30 days, so now it's 90 days. Also important to note here that if you're overseas, you may only purchase coverage by TRS or TRR either over the phone or at a TRICARE service center. Most of you, I'm sure, are aware by now that TRICARE service centers stateside went away. However, they do remain in place overseas. So that is still an option for those overseas to go in and submit an enrollment request for either in person. Next slide, please. So for TRS and TRR costs, below you'll see a chart that reflects the monthly premiums, the catastrophic caps, and co-pays or cost shares. In addition to the many changes that occurred on January 1, 2018 that were made to TRICARE, along with their health plans, TRS and TRR currently now fall under what is categorized as a Group B cost sharing, meaning that this population of beneficiaries were not grandfathered into a previous existing cost structure. I don't want to get into too much of that. If you have questions about TRICARE costs, be it for TRS, TRR, or any other health plans, you can always go to www.tricare.mil/costs. So you will see in the chart below that when you do see a network provider, you pay a copay versus paying a discounted percentage, which was prior to this year of that cost share. And a non-network, you will still pay a cost share to the TRICARE maximum allowable charge at the percentages stated in the chart below. So a key change here again When seeing network providers that are in the TRICARE network providers as a TRS or TRR beneficiary, you would now pay a copay rather than a discounted cost share, percentage cost share. Whereas non-network, you will continue to see, you will continue to pay a percentage to the TRICARE maximum level charge, which is also referred to as a cost share. For differences of network versus non-network provider, a network provider is considered to be a provider in a prime service area, that which is deemed by the contractor and Defense Health Agency. And those are typically in and around a military hospital or clinic, which is also referred to as a military treatment facility or MTF. So a non-network provider would be that which would be still TRICARE authorized and accepting to see TRICARE patients and to bill according to TRICARE rates, and they are typically outside of that network or prime service area. Next slide, please. So getting care if you're enrolled in TRS or TRR, those two health plans do still follow the rules of TRICARE Select, again, which was previously TRICARE Standard. You can see any TRICARE authorized provider and also say when seeing one in the network, as I stated previously. Referrals are not necessary for specialty care, but some care may require prior authorization. To find out which services do require that prior authorization, you can visit, again, www.tricare.mil, or you can contact your regional contractor. You are eligible to be seen in a military hospital or clinic on a space available basis. And to locate a military hospital or clinic or MTF nearest to you, you see a link here where, again, at tricare.mil/MTF to punch in, again, zip codes to locate an MTF that would be nearest to you. Keeping in mind that certain clinics and hospitals, depending on the size and capabilities, may or may not see certain beneficiary categories, and you can call the patient admin department prior to inquire about that. Next slide, please. So as you will see, specifically for accessing care in a military treatment facility, here is the priority echelon in which various statuses or beneficiary categories are prioritized when trying to access care in an MTF. Particular note in priority 4 and 5. 4 is where your TRICARE Reserve Select folks would fall in. They're also considered as active duty family members who are not enrolled in a prime option. And then 5 would be particularly relevant to this webinar, TRICARE retired reservists and their family members that are covered by that health plan and not in a prime option as well. Next slide, please. So line of duty, this is a program that's limited only to the sponsor for an illness, injury, or disease that's incurred or aggravated in the line of duty or while performing military service for 30 days or less. This also covers traveling to and from the sponsor's duty assignment and staying overnight. And again, typical performance of duty or service with a reserve component member with 30 days or less, again, would be either their weekend drill, IDT, AT, or any other type of order. Again, no more than 30 days. In order to begin or access line of duty care that would not be a cost to the sponsor's unit must initiate and get an approved line of duty determination in order for such care to be covered. If the sponsor is near an MTF, that MTF will manage the sponsor's care under the line of duty, and if outside an MTF area, the Defense Health Agency Great Lakes will manage the care. Important to note here that line of duty care is, or for that matter, any other care relevant to line of duty does not fall up under the Tricare Assistance Management Program or any other health plan. Next slide, please. Early eligibility refers to a period of when a reserve component member receives delayed effective date orders for active duty in support of a contingency operation for more than 30 days. With that, the sponsor and their eligible family members would become eligible for Tricare active duty like benefits coverage up to 180 days before the actual date the active duty would begin. It's always the latter of, meaning depending on when the orders are actually issued or when they report to active duty. So an example would be if the member received delayed effective date orders, let's say 3 months or 90 days prior to their active duty date, then they would only get the actual 90 days of the early eligibility benefit. It's important to note here that it is up to the sponsor's personnel office to update this in DEERS first. They are the ones that provide the eligibility in DEERS, which would then indicate that they would, the sponsor and their family would then be eligible for this particular benefit. And again, as I mentioned, this would provide the active duty service member benefits as well as their family under the active duty like options. Important, next slide, please. This is extremely important to note here. If at any point the sponsor's orders are terminated prior to their actual reporting date, the active duty coverage ends on the date of which the orders were provided. From there, the sponsor may qualify to either purchase TRS coverage or continue health care benefits program coverage. If an option for either of these, the sponsor may look to reinstate previous employer-sponsored health care coverage. So that is another option. So if the sponsor does not qualify for TRS or any other Tricare coverage, if in fact orders were terminated prior to report date, they can also look to reinstate that employer-sponsored health plan insurance and coverage if they had that prior. And again, really emphasis here, and important to note that the eligibility ends on the effective date the orders are terminated. So even though the early eligibility may have been for up to 180 days, the day those orders are terminated, if a command decides to stand down a unit from deploying or what have you, the care under early eligibility is immediately terminated on that date. So any future care, again, would be whether or not the sponsor qualified for TRS, whether or not they purchased continued health care benefit program coverage, or would then have any care from that point on covered from their employer-sponsored health plan. One thing I would like to point out here, while it's still in its developmental stages and hoping to have something out here in the next couple weeks, currently the Manpower and Reserve Affairs, as well as Personnel and Readiness, are working on implementing recent legislation that was under Section 511 of the National Defense Authorization Act of 2018, which now has also included those RC members who are put on 12304 Bravo or B orders that are related to pre-planned missions for 180 days or more. The early eligibility benefit is now extended to those members and their families as well. There's a memo and some instruction that is being finalized currently, and hope to have signatures here very soon to get this implemented. So be on the lookout be mindful that, again, this added category of those members put on 12304 Bravo, or what we refer to as pre-planned mission orders, now also would qualify and be eligible for early eligibility. Next slide, please. For active duty benefits, sponsor may enroll in Tricare Prime during early eligibility if near an MTF or in a catchment area, again referred to also as a prime service area. However, they cannot enroll in Tricare Prime with a civilian primary care manager. However, the sponsor may get routine care with any Tricare authorized civilian provider. Again, keyword routine. While they may not be able to enroll with and establish a primary care manager as a civilian, they can still obtain routine care with a Tricare authorized civilian provider. For specialty care or urgent care, the sponsor must contact the Defense Health Agency in Great Lakes or the regional contractor for assistance with seeking this type of care. And ultimately, once the sponsor does arrive at their final duty station, they will follow command guidance about enrolling in Tricare Prime. Now, for family members, they're considered, as I stated earlier, they're considered as active duty family members during the early eligibility period. And listed here are some health plans available to those family members in which they must enroll in one of these plans for coverage to be effective. And I will get into a little discussion here about automatic enrollment, and this is something that changed January 1 of 2018 as well. Anytime a reserve component member is activated for more than 30 days, regardless if it's in support of a contingency operation or not, or if it's under 12304 Bravo orders or not, again, any activation for more than 30 days, family members will be automatically, if in a prime service area, enrolled in Tricare Prime. If not in a prime service area, they would then be enrolled in Tricare Select, at which point the family members would then have the option to elect to disenroll from either of those coverages if they chose to do so. As far as obtaining remote or Tricare Prime remote for active duty family member coverage, that is something that the family members can do once established as such in DEERS. Also important to note, during early eligibility in the active duty period, sponsors are not eligible to enroll in Tricare Prime remote unless they are actually assigned in a location, in a remote location, and not deployed in a combat theater. And again, you'll see, there's various health plans here. As I mentioned, I'm not going to read them all out, that in which the family members can look into as far as enrolling. Next slide, please. For the Tricare Dental Program, this is a voluntary premium-based dental coverage plan. It's available for purchase. The benefit is administered by United Concordia, and premiums are based off of the sponsor status, as you'll see below. The nice caveat to the Tricare coverage, unlike the medical, as far as the dental, IRR and inactive National Guard family members and the sponsors are eligible to purchase this particular dental coverage. Important to note, these rates are effective currently through April 30th of this year, 2018. So as far as any rate changes or anything to that effect with the dental program, you could always go to tricare.mil/TDP. Next slide, please. Transitional Assistance Management Program, better known and is referred to as TAMP, may be available to certain RC members and their family members if the reserve component member was activated for more than 30 days in support of a contingency operation, TAMP does provide transitional medical coverage of 180 days and begins the day after coming off an active duty period, again, of more than 30 days. During TAMP, both the sponsor and family members are all considered as an active duty family member. Again, the sponsor, his or herself, is also considered a family member as an ADFM during TAMP. If family members and the sponsor were enrolled in Prime prior to coming on TAMP, they would be required to re-enroll. And then also for Select, again, it's mandatory enrollment. And then if a family member or the sponsor during TAMP elected to remain in Select, they can do so. Dental coverage for the sponsor would remain during TAMP under the active duty dental program, while the family members may continue under the Tricare dental program coverage. I will also note here, just like the early eligibility benefit, that the TAMP benefit was also included under the recent legislation under Section 511 of NDAA fiscal year 2018. Again, which included and extended this benefit to those RC members put on 12304 Bravo orders or pre-planned mission orders. And those orders typically are for 180 days or more. So again, just to emphasize that this TAMP, in addition to early eligibility, were added under the recent legislation to the additional category under 12304 Bravo. Also to note here under TAMP, it does, as I mentioned earlier, under line of duty, it does not cover line of duty care. Next slide, please. So Continued Healthcare Benefits Program, or CHCBP, is a COBRA-like health plan that is available to RC members and their families if and when they no longer qualify for any other Tricare healthcare coverage. It could be when they come off active duty, or if they no longer re-enlist or they separate from the service. That would be an option for the sponsor and their family members. So that's something for consideration to purchase this coverage. As you will see, however, it is not cheap. The premiums, this is a premium based, this is where you're paying premiums and you pay quarterly. So as you will see here, again, not cheap, and that's again why we emphasize when considering your healthcare options for your family that you look at all your options. And again, your state exchange or marketplace might be an option in which you would find a much cheaper monthly premium healthcare coverage program. Also wanted to mention that this, I'm sorry, next slide, please. Also wanted to mention that this particular program, CHCBP, is administered by Humana Military for all regions. In the contact information, we have that at the end of the webinar. And then most importantly to note here, when coming off any other Tricare coverage and losing eligibility for any other Tricare coverage, and you wished to purchase CHCBP coverage, that must be done within 60 days from loss of that other coverage, and not 90 like some of the other health plans. So again, 60 days for CHCBP when loss of other healthcare coverage under Tricare. And that's in order for continuous coverage, by the way. Next slide, please. So if you have other insurance and how it relates to Tricare, Tricare always pays secondary to any other health insurance, with the exception of only when that other health insurance is Medicaid, in which Tricare would pay primary and Medicaid would pay secondary. It's important to know here, if you do have other health insurance, you need to submit and what we refer to other health insurance as OHI. You would need to submit an OHI questionnaire to your regional contractor or fill one out and turn it in at a military hospital or clinic. Important to note, you should always follow that other health insurance referral and authorization rules first when seeking care, again, because Tricare pays secondary and follows what your other health insurance rules are in place. And always inform your provider of all your health insurance coverage, meaning if you have other health insurance in addition to Tricare, make sure you provide any and all providers with all insurance information. Next slide, please. So the nice thing with the reserve component members is they are protected with their healthcare rights. RC members are protected under the Uniform Services Employment and Reemployment Rights Act, or what's referred to as USERRA. What this does is it allows those RC members, if they had previous health insurance coverage, i.e. existing employer-based health care, to have that reinstated when they come off of an activation, if they choose to use that. So again, it's just important to know that our RC members have rights under this act, and again, if they find difficulties with an employer that's wanting to or not wanting to provide them or extending that pre-existing employer-sponsored or employer-based health care, that they can reach out to support agencies with a website and phone number listed for assistance with getting things ironed out with that. Next slide, please. Here you'll see the three current, as of January 1st, 2018, regional contractors, as well as their contact information. What was previously, prior to January 1, was we had a north, south, and west stateside region, and those, the north and south did merge to the east. So you will see that's managed by Humana. And the new Tricare West region contractor is HealthNet Federal Services, which was prior United Healthcare. For Tricare Overseas, you'll see the International SOS is still in place. So if you have any questions, again, on any and all, our regional contractors are also there to assist you as well. Next slide, please. And here you'll see further, a little bit more in-depth or specific overseas call centers for various locations overseas, be it Eurasia, Africa, and when we refer to Eurasia, certain parts of Asia and Europe, Latin America and Canada, as well as the Pacific. So again, those are some additional contact informations overseas. Next slide, please. So at this time, I want to thank you for joining again today. And at this time, Stan, open it up for questions.
All right, thanks, Brian. One of the things that kept coming up in the queue was the reference of the reserve component. So a lot of questions wanted to know if the National Guard was the same as the reserve component.
Okay, and you know what, and I apologize for not up front. Yes, and the reserve component is comprised of all seven, what they technically refer to as reserve components, and it does include the Air and Army National Guard.
Okay, the next question reads, does the Tricare Reserve Select option cover DOT physical?
I'm sorry, DOT?
Yeah.
Okay. So physicals, if there's a service required physical, then that's something that should be covered through your unit in what we refer to as operational funds and maintenance funds. As far as I'm not sure what DOT means, but nonetheless, if you have any questions about what is covered by Tricare Select, Tricare Reserve Select, or any other Tricare health plans, you could always go to www.tricare.mil/covered services.
And Brian, this is Calvin. As a whole, no, Tricare does not cover physicals as a whole except for children up to a certain age. There are components under the preventive health care services that are part of a physical that may be covered, but a physical in its entirety is not a Tricare covered benefit.
Thank you, Calvin.
Okay, next question reads, did the tax overhaul current administration changes now end the requirement for minimum medical health care coverage?
Unfortunately, I can't answer that question. I'm not familiar with what any changes within the administration or anything current with the tax laws and its impact on the Affordable Care Act. I do know, however, we maintain and update a web page on our website, again, tricare.mil/ACA, with any information regarding that. What I will say is you could, in the slide, there was a website or two links that you could go to as well for questions about the Affordable Care Act.
Okay, thank you. The next question reads, when a new baby is born to family with TRS coverage, is the baby immediately eligible as long as enrolled within 90 days? I recall prior to 1/1/2018, baby was ineligible until enrolled with claims denied.
So for newborns, it's considered a qualifying life event, and across all health plans in Tricare, not just TRS, but all health plans, sponsors have up to 90 days in which claims will be pended to get a newborn registered in DEERS and enrolled. Important to note, there's a misconception that new family members or parents of newborns have to wait until they receive a raised stamp copy of the birth certificate from the county in order to register them in DEERS. That is not true. In addition to that, you can also use a live birth certificate that should be provided to you before discharge from the hospital, and any DEERS Rapids ID Cards office or DEERS DMDC support office will accept that document as a official and appropriate document to register that newborn in DEERS. So 90 days to register the newborn and get he or she enrolled in whichever health plan you're looking to enroll that newborn in.
And this is Francine, just again as a point of clarification, the claims will deny until both of those actions are completed, and then once they're in DEERS and enrolled, you can request that the contractor go back and process any claims from the date of birth forward.
Thank you. Next question reads, we are finding that what is being reported in DEERS isn't flowing to the system the contractor utilizes to verify coverage. Members are having to cancel appointments because of these inconsistencies. Is DHA aware of this issue? Really haven't had any issues until the contract change.
Yeah, unfortunately, with the transition with the contract change January 1, 2018, and it was a massive overhaul, not only to the Tricare program in its entirety, but also to the transitioning contractors and their systems, and most impactful DEERS. So we do apologize for any inconveniences. However, any and all issues with systems and DEERS feeds either have been or are currently being worked on for resolution. What we suggest is if you are experiencing any eligibility issues, reach out to your regional contractor, If they, and then if it is an issue related to the transition, they can always go back and reestablish any healthcare coverage that the sponsor and family members were entitled to. And again, the transition, they're still ironing out a few things, but for the most part, any issues either have been resolved or are really close to being finalized as far as resolution. Now, if there are personnel issues in eligibility, meaning that a sponsor may be having eligibility issues reflected in DEERS, that is something that needs to be taken up with the sponsor's personnel office at their unit.
Thank you. Is the TRS enrollment now available via BWE? Last I saw on the website, it was coming soon.
Yes, great question. And as I mentioned earlier, now you can submit an enrollment request for TRS through BWE, and the other nice addition to January 1 with some of the changes is folks can now call their regional contractor, and if they qualify, they'll go through a series of questions, would then be able to also submit a enrollment request over the phone.
Okay, thank you. Next question reads, if drilling reservist has a spouse that qualifies for FEHB and purchases family TRS, can the spouse cancel terminate FEHB coverage?
Yes. So that is an option. Now, the important thing to keep in mind here, in which we always advise with this balancing TRS or TRR and FEHB eligibility, it's important to know that if the spouse were to voluntarily disenroll and terminate their FEHB coverage, and then go over to the sponsor and then subsequently purchase TRS member and family coverage, that if for some unforeseen circumstance to where the reserve component sponsor were to no longer qualify or be eligible for TRS, then they would not be able to go back into their FEHB coverage until the next open enrollment season.
Okay, thank you. Next question. So within 90 days of my 60th birthday, I can apply for Tricare Select from Tricare Retired Reserve. Correct.
Now, that's keeping in mind that DEERS and everything is reflected as such. Yes.
Okay, thank you. Next question. Does the TRS / TRR copays apply before or after the Tricare Select deductible? And does the copay apply towards the deductible?
So with any deductible, with any health plan with a deductible, the deductible must be met first, and then Tricare would then begin to do the cost sharing.
Okay.
Francine or Calvin, or if you have anything to add to that?
No, you're exactly right. They have to meet that deductible, and then after that, the copays would apply.
Cost shares would apply to the catastrophic cap. Yep.
Yes.
Okay. Next question. Planning ahead, retired National Guard. How can I determine now if I will be eligible for Tricare when I turn 60?
Unless something unique were to occur, in legislation, it's an entitlement. Any retired guardsman or a reservist or an active component retiree, once they reach age 60, well, let me rephrase. For the reserve components, including the guard, once retired and turning age 60, they should have the entitlement for premium-free Tricare coverage.
Okay. Next question. Revoked and rescinded orders are also considered terminated? That's a question.
Yeah, so typically revoked, rescinded, terminated, Yeah, our understanding from the Manpower and Reserve Affairs and Reserve Integration is that any and all orders that are regardless of the terminology used, to where they're completely removed, be it if it's rescinded, terminated, or what have you, it is in that line of understanding to which it would impact Tricare eligibility. And again, it's all based on what the service members' personnel office loads and deers accordingly. So if one thing to also note, it used to be problematic years ago, is members that did have the early eligibility benefit and services, unfortunately, were going back, and when they were terminating the order, they went all the way back to day one. It is our office's understanding of late that has since been resolved through a lot of efforts of educating the reserve components and the personnel side to not go back and remove it. If there's a decision, let's say as an example here, hypothetically, if a reserve component member, again to include the guard, is ordered delayed effective date orders and they get the early eligibility, and down the road their command says, you know what, we're not going to send anybody out, they're going to stand the unit down, then we ask the reserve components and the personnel offices to then cancel that early eligibility on the date the decision was made to stand down and not from day one. So so if there are any RC members that are experiencing issues with that, that is out of Tricare's and the Defense Health Agency's hands, and that's up to the services of if and when they have the effective date of the termination.
Okay, next question. I'm a reservist who is not yet fully gained by my command. How to register in this case? I'm just coming out of A and C school.
So any questions with affiliation and effective dates of when you're actually in the reserves or in the guard, that's something I have to defer to your service personnel.
Okay, thank you. Next question. Under TAP, if service members has ADDP, does the family still pay the active duty rates, or are they moved to the selective reserve premiums?
Great question. So during TAMP, and while the sponsor's in ADDP, the family would remain, I'm sorry, scratch that. And Francine and Calvin, correct me if I'm wrong, the TDP rates should revert back to non-active duty status, because the sponsor technically is no longer active duty, even though they're receiving active duty-like benefits.
That's correct, Brian. And in addition, with the ADDP for the sponsor, it's only that they can use it at the dental treatment facility during the ADD period. For guard and reserve, yeah.
They can get a guard reserve.
All right, thank you. Next question reads, is Tricare primary for ADSMs?
Yes, when a service member, especially in the reserve components, again, including all reserve and guard, the sponsor, the service member themselves, by law has to be covered by Tricare as their primary.
Okay, next question. Is there a Tricare health insurance ID card?
Yes, Francine, Calvin, correct me if I'm wrong, those are still either sent out or notified to family members, in which they can, they're explained and informed on how to obtain one.
There isn't what's a Tricare ID card. You can obtain one you can obtain a Tricare card by going to Mill Connect and printing it out, but it's really not considered an ID card to get care, all you really need is your military ID card and orders if you're not, listed in DEERS as of yet. So it's not really a TRICARE ID card per se, but there is a card that you can print out in Meal Connect that has the regional contractor, the phone number that's affiliated with the region that you're in.
Next question. Do you have any suggestions, excuse me, on how to pull up a child's eligibility when they do not have an ID card?
Again, to pull up any family members to see whether or not what their eligibility status is in DEERS with regards to TRICARE, you can go to Milk Connect as well as I want to say in addition to Milk Connect, you can also go to I don't know, Francine, Calvin, is there another application with DEERS that they can go to, or is it just Milk Connect?
They can look in VWE as well, and that'll show who all is enrolled. But for purposes of somebody says, well, normally ID cards aren't issued to children until they reach age 10. And so for claims processing and eligibility purposes, truly a provider can call the regional contractor and confirm eligibility through the regional contractor, who can see in DEERS whether or not that child shows as covered under TRS, for instance. Again, it might show that a child is eligible, but it may show that they have no health plan coverage if the sponsor hasn't taken the action to go ahead and actually enroll them in TRS or even TRR.
Okay, the next question. Who is the POC at DHA for problems with Humana?
That would be the TRICARE Regional Office East. I do not have, I do not unfortunately have the TRICARE Regional Office's contact information in this presentation. You can obtain that by going to tricare.mil contacts, or always use the wonderful Google and just Google TRICARE Regional Office East.
Okay, next question. I'm finding more and more employers that are insisting that members sign back up with their civilian insurance once they return from a deployment and not allowing them to fully utilize TAMP benefits.
That's something to take up with the USERRA, because if they're entitled to other premium-free coverage, that would obviously be more advantageous and beneficial to them, especially if the employer-sponsored is something that the employer doesn't either pay or subsidize premiums or pay entirely. Then there has been instances in the past where with employers that insist people sign various statements and documents that they will or will not or what have you. Always prior to, you can confirm by calling USERRA, and one of their agents would be able to specify that a little bit further and assist that member.
Okay, I'm going to take 1 to 2 more questions since we are at the top of the hour. The next question reads, what region does a member need to call if in Maryland, east or west?
East.
Okay. Next question, with auto enrollment, will beneficiaries be notified where they are enrolled by letter?
Yeah, anytime there's a status change, and that's why it's important to maintain your DEERS information and update, specifically more so the residential and mailing address, is because, yes, you will receive a notification in the form of like a postcard, if you will, which will explain a very brief summarization about something's changed with your TRICARE, and it will direct you to Milk Connect. in which then we'll have a link and a letter further explaining and more detailed about be it a change to an enrollment, gaining or loss of, or what have you.
And this is Francine. I just really want to very much emphasize that because that letter or notification is what we call it here is based on what you have in the Defense Enrollment Eligibility Reporting System, DEERS, DMDC, your rapid centers, you really need to pay attention to that. And I know sometimes Guard Reserve going on and off don't think a whole lot about that. And oftentimes you're really not moving quite as often, but truly that's the information that is used to send out any notices about changes in your TRICARE benefits, whether it's gaining eligibility, losing eligibility, confirming what payments, not payments, whatever that might be. So always make sure that address is up to date.
Okay, and the last question, will retired, yes, go ahead, Calvin.
Dan, I apologize, and I wanted to clarify something and go back to the active duty dental program benefit during TAMP, because I did specify that if the member lives within the catchment of the NTF, they should be getting care at the dental treatment facility. If they have availability, if in a remote location, they should still follow the requirements of the ADDP by calling United Concordia, who is the ADDP administrator, to get authorization for the care that they need. Or I forgot what the special number is they have to get in order to get that care. So just make sure that they follow those requirements.
Okay, thank you. The last question, will retired reserves that received VSI be eligible for TRICARE upon turning 60?
Francine, Calvin, you want to touch that one?
No, we're going to have to really go back and look at our records on that, because there was a whole element of clarification on what that stood for. We'll see. It's a unique situation.
Yeah, it's a unique qualifying. It's a unique qualifier, but there has to be certain criteria met in order for someone to even be eligible for benefits. After being getting that identified, but I cannot recall that off the top of my head. I really can't.
Right.
We can research this and any other questions that aren't answered. We can and get back on that.
Okay, thank you. Well, at this time, I would like to thank our presenter, Brian Smith, for sharing his invaluable experience and information. Also want to give a special thanks to to the customer support team that represented today. I would also like to thank our attendees for participating in today's webinar, submitting their questions, and listening to the presentation. If you find yourself having questions after the webinar is over, please email moswebinars@militaryonesource.com, and I'll send these questions over to the presenter for an answer. This concludes today's webinar on TRICARE choices for National Guard and Reserve members. Thank you all for attending, and have a great day.